Hello everyone and welcome to this new lecture. Today we will be talking about something important, and it is all about the overbite. Now, what is the overbite? I will explain to you what the overbite means, so please focus. Overbite, it is and it occurs in three planes: sagittal plane, horizontal plane, and transverse plane. Again, sagittal plane, vertical plane. No, this is the transverse plane, sagittal plane, transverse plane, and the vertical plane. Sagittal, transverse, and the vertical plane. Vertical is the same as coronal plane. I will give you more information right away. So overbite normally, or let's start with a definition. It is the vertical overlapping of the mandible incisor by the maxillary incisor. Mandibular incisor by the maxillary incisor. It's the vertical overlapping of the mandibular incisor by the maxillary incisors. The normal value of this overlap is 1/3. The upper central incisors or the vertical upper incisors, the maxillary incisors should cover 1/3 of the crown of the lower incisors. That is the normal value. Here is the normal value. But if it increases, if it gives more than 1/3 of the mandibular crown, central incisors, generally an incisor doesn't have to be central, could be a lateral incisor too. This would be considered to be more than normal if it's more than a third the coverage. One second. There are some features that are considered when assessing the overbite. These features include amount of overlap, as we mentioned before, 1/3 or more or less. Whether the lower teeth are in contact with the opposing teeth, that would be a complete overbite, which is very wrong and could be traumatic. Even if the lower teeth are in contact with the soft tissue of the upper maxillary. Or if they are not touching, it is called incomplete overbite. So these are the two classifications or the two types. If there is a damage or a trauma to the upper tissue, it would be described as traumatic overbite. Now we move on and talk about the open bite. What is an open bite? Also a malocclusion in the vertical plane. This is the vertical plane, and this is horizontal or transverse plane, and this is the sagittal plane as we discussed before. Open bite, there is no overlap, as we mentioned before, that in overbite there is an increased overlap, but in overbite there is no overlap. Even 1/3 of the lower mandibular incisors are not covered by the maxillary incisor. So there is an open bite If it's covered 1/3 of the lower crown, it would be a normal overbite, but if it's more than third, it is an increased overbite. Open bite, meaning there is a gap between the maxilla and mandibular teeth. And this gap is in the anterior side of the denture. Two types according to position of overbite. There is anterior overbite and posterior unilateral or bilateral open bite. Other classifications of open bite are the classification according to the complexity of the open bite, if it's skeletal or dentoalveolar. In dental overbite, there is the simple case. There is a lack of vertical overlapping of mandibular teeth by the maxillary teeth without skeletal malocclusion, so it's a simpler case. And this could result from a dental eruption. From dental eruption and dental origin, there is no skeletal defects. But when it comes to skeletal overbite, there is some characteristics of this skeletal anterior open bites. These could be enumerated as there would be problems with the cephalometric reading of the facial analysis. First of all, in this one, or in this case of skeletal interbite, skeletal structural anterior open bite, there is an increase in the Frankfurt mandibular plane angle. Frankfurt mandibular plane angle. There is a steep occlusal plane angle. Steep. Increased syllanesion, menton, ponion, MP angle, syllanesion, and MP ponion. There is a short mandibular ramus. This one's very short, is going to be. This one is very short. Increased mandibular body length. Downward and backward position of the mandible. Increased gonial angle. Proclined upper incisors. Retroclined or upright lower incisors. There is a posterior part of maxillary step downward. Posterior facial height equals 1/2 of the anterior facial height. Increased hard tissue, lower anterior facial height. And there is an increased total anterior facial height. Short mandibular ramus. Short mandibular ramus. We mentioned this point twice, as it is written twice, but It is very obvious. An excess eruption of the maxillary posterior teeth could cause this open bite, or an increased facial height of the anterior lower incisors. And more etiology, though I will give you of the open bite. I will give you this important information that you don't have to look out, and it will benefit you after I drink this water. The major cause of anterior open bite are forces that result from thumb or finger sucking, pacifier use, lip and tongue habits, airway obstruction, inadequate nasal airway creating the need for an oral airway. That means mouth breathing, allergy, septum problem and blockage from turbinates, enlarged tonsillis, enlarged tonsils, and any adenoids. Skeletal growth abnormalities could also play a part in causing anterior open bite skeletally. And we'd have to remove the cause of anterior open bite in order to get a treatment for this problem. For primary teeth, we'd have to use habit control methods, behavioral therapy, improving habits, watching the swallowing action of the patient, if it's correct or wrong and abnormal. Training the tongue, lips, and training on how the patient should breathe. Oral screen, oral crib therapy, that's a prosthodontic. Lip bumper, functional appliance, top sucking control appliance. Now let's talk about how to treat permanent open bite. We can treat those with elastics as part of fixed orthodontic treatment. We can use bite blocks, high pull hedger that will extrude the posterior teeth. Actually, it will do intrusion in the posterior, in the molars. Intrusion will intrude the molars, not extrusion. Intrusion. Orthognathic surgery is also considered. And now let's go next to the deep bite. An explanation for deep bite: it's an increased overbite, more than 1/3, and mandibular teeth would be overlapping maxillary teeth. and mandible would be in a state of cover bite. Sometimes it would be cover bite, overbite, or even overbite, deep bite. Talking about the cover bite, it's a complete covering, overlapping, increased overbite. The mandibular incisors are covered completely. Well, this usually happens in class 2, division 2. Class 2, division 2. So this is class 1, this is class 2. Again, this is class 1. This is class 2, division 1. This is class 2, division 2. But in this case, there will be a cover. The central incisors, lateral incisors upper would cover the lower incisors. So if a question comes in the test or in the life, what is the angle classification usually associated with cover bite? Answer is class 2, division 2. Traumatic overbite or complete. Moving on. Closed bite. The upper incisors covering all the lower incisors. Same old, same as we mentioned before. But in this case, we will talk about treatment. Treatment, how to treat closed bite. I will tell you how. Extrusion of posterior teeth, intrusion of anterior teeth, combination of both, extrusion and intrusion, proclination of incisors. If it is proclined, like that, it will cover the lower incisors. Last but not least is the surgical treatment. And extrusion of posterior teeth, we can use bionator functional regulator twin blocks that will allow extrusion of posterior teeth. Also myofunctional appliance, hedger, cervical hedger, that's another appliance, functional appliance. And that one should be worn 12 to 16 hours per day. Even in sleep, the patient should be wearing it. Another appliance that's used, in this case, intrusion of anterior teeth, it's called J-hook hedger. That will correct the closed or deep bite. And that was our lecture today about overbite. Thank you for listening, and I hope you have really good information. It's just the beginning, by the way. It is not a really full, in-depth lecture. We give an overview about these types of malocclusion in dental arch and how to deal with them orthodontically. Thank you and goodbye, and hope to see you next in a better, more in-depth lectures.